Medico-legal issues in euthanasia and life support system. Page number 236. So there are a lot of ethical dilemmas for doctors when it comes to taking a decision regarding euthanasia, or even to withdraw a life support system. In India, it's usually withholding or withdrawing life prolonging treatments. Euthanasia is not practiced in India, but withdrawing or withholding life support system or life prolonging treatments is still practiced in India. Okay, so ethical dilemmas, what the physician may go through is sometimes, according to Hippocrates' oath, we are not supposed to cause more harm. Okay, so it means that sometimes it feels like treating a person is more harmful than not treating them in certain situation, or continuing the treatment is more aggressive and it has more distressful impact on the patient's psyche as compared to not giving any treatment. Okay, so who are we to judge? It's very subjective. Okay, is it appropriate for the physicians to judge on patient's behalf, or is the patient themselves saying it? Okay, in most of the situations the patients are not able to just venture this out, and it's a emotional guess that the physicians or the family members can partake. Okay, so this is the ethical dilemma that physicians go through. So coming to the indications in which we can withhold or withdraw life prolonging treatments, okay, according to the good practice in decision making, even in India, these indications are followed. Okay, the first is brain death. When the patient is in a brain dead situation, which means there is an irreversible stoppage of circulatory or respiratory function, which cannot be reversed back. Okay, irreversible cessation of all functions of the entire brain, including the brain stem. Okay, so because brain cells are, if any damage happens to the brain cells, it is irreversible. Okay, whenever there is an irreversible damage that took place to the brain, which stops all the functions along with the brain functions, we consider the patient as brain dead. In brain dead situations, you can opt for withholding or withdrawing the life prolonging treatments. Okay. Second indication is the permanent vegetative state. Okay, as a result of severe hypoxia, this happens. Even if you are aware of Anita Schonborg case, okay, that she was also the nurse Anita Schonborg. Okay, she was also in the permanent vegetative state because of severe hypoxia, which means the patient is not able to react or even relate to the outside world. Okay, and they are completely reliant on the caretakers to give them even nutrition, physical hygiene, but they are emotionally and mentally they are not at all relating or reacts to the outside world. Okay, they are in a comatose situation, they're in a permanent vegetative state. In this situation also, we can opt for withholding or withdrawing the life prolonging treatments. The third indication is the no chance situation. For example, if the patient has severe diseases that life-sustaining treatment simply delays the death, there is no chance at all that the patient can recover from what is going to happen. Death cannot be taken out of the picture. Death is going to come sooner or later. Whatever treatment you are giving is just keeping the patient alive. It is just delaying the death. When any patient is in such kind of significant suffering, okay, and the treatment that you are giving is just to, it is not even alleviating the suffering. You are just keeping the patient alive, but the patient's suffering has no limits and bounds. Okay, the patient is still in a suffering stage. Treatment is not taking away the pain. Okay, it's just keeping the patient alive. So that is a no chance situation. In such situation also, you can go for a DNR policy with consent of the patient or with the patient's family members as well before the treatment is given. If the patient goes into a stage of no chance situation, you can activate the DNR policy, do not resuscitate policy, okay, in which life-saving treatments will not be used. You allow the patient to peacefully pass away. Fourth indication is the no purpose situation, okay, which means even with treatment, the patient can survive, but the degree of physical or mental impairment which has already been caused, it cannot be reversed back, okay, and it is unreasonable for us to expect that the patient is okay with it, okay. So that is a no purpose situation. Treatment can definitely keep the patient alive, but what kind of dignity of life are you providing to the patient? That it's a life of no purpose. The patient does not have a physical or mental capability at all. Just for the sake of being alive, the patient is kept alive, okay, and the patient's survival will be impossibly poor in such situation. uh, no purpose situation, with withholding or withdrawal of life prolonging treatments can be activated. Then there is an unbearable situation, the fifth indicator, in which the progressive and the irreversibleness of the illness is such that if if any more treatment is given, it cannot be taken up, okay, it cannot be borne. You cannot bear the situation where new treatments are just added on, but there is no improvement at all in the patient situation, okay. And in this situation, you can make sure that you withdraw a particular treatment or the entire further treatment. The parents or the family members or the patient themselves can withdraw from the treatment, okay. Usually in situations of final stage cancer patients, okay, they go for the unbearable situation where they know that no further treatment can save them, death is inevitable, okay. So instead of going under the needles and under painful chemotherapies over and over again, it's better I refrain from all kind of treatments and let the death take its own way. Let it come eventually, okay. That is the unbearable situation. So having a DNR policy in such situation, it definitely helps the doctors to make a professionally competent decision. Okay, human rights and child rights are also very important when such decisions are being made in situation of unbearable um, situations. And proxy consent can also be taken into place because the cost of the treatment is borne by someone else. If they can no longer pay for the they can give the proxy consent that they are financially not capable of continuing the treatment. So the government agencies or the NGOs are responsible for continuing the treatment. Next, coming to the legal aspects of ventilation in children. There are other points also regarding DNR, which you can read on your own. It's simply they have explained other guidelines and aspects of DNR. Okay, as a physician, what you have to take care of. So, legal aspects of ventilation in children. First is the consent. Consent for ventilation is taken by the parents, okay. Patient, if it's an adult patient, then you can take from the patient, but otherwise from the parents, consent for ventilation is taken. And there are certain indications of ventilation which has to be considered as well. If the patient if it is a situation where the child, if it is not ventilated, and especially when the elective ventilation is been proposed, and what are the consequences if the child is not ventilated. If the consequences are really bad, go for ventilation. What are the possible alternatives apart from ventilation, okay, you have to explain that as well. You have to inform this also to the parents. Duration, how long will the patient be on ventilation, okay. What is the end result, is the most probable end result of ventilation. What is the cost of treatment, putting a child on ventilation for 1 day, what is the cost of it? What is the outcome of this intervention, okay. Is this ventilation a primary treatment which takes place in same disease condition, which with also children who suffer from the same disease. In other cases also, is ventilation given as the first treatment methodology. You have to explain these all details, okay. These all information has to be given to the parents while taking the consent for ventilation. Second, in absence of suitable person to provide consent when intervention is urgently needed, what can be done? If it is a life-threatening situation, the doctor has to take up the ventilation without even waiting for the consent, because if it is an emergency situation and the doctor is very much sure that ventilation can save the child's life, okay, waiting for the consent may the child is salvageable, and waiting for the consent may lead into a situation where the child may pass away. Okay, in such situation, in emergency, without even consent, the doctor has the right to put the child on ventilator even without the consent of the parents. Okay, in such situation, it is always better if another consult's opinion is also recorded in a sheet. Okay, and the similar situation applies for surgeries as well. Okay, you can't wait along with the consent for surgery when the situation is time uh, derivative. Okay, in such situation, take another expert's or a consultant's opinion, come to a decision together, and then proceed with the treatment. If there is a risk of a child dying, you have to proceed with the treatment without waiting for the consent to come arrive. Third situation, payment of expenses where treatment prolongs beyond expectation. Okay, you have put the patient on ventilator, but what you had forecasted is not taking place. The child requires further more treatment, further more days on ventilation, and the payment cannot be done by the patient's family. In such situation, like out of emotional upsurge and social pressures, people can just consent for the ventilation, but as time passes by, especially when the response of the patient is not as per the expectations or what they believed in, that's when they get stressed out, and the family will find it very they're not able to take a decision of discontinuing the life support. Okay, so what happens is that there is no clear laws or guidelines to deal with such situation. Okay, so however, you have to make sure that treatment should not be discontinued. Even if the parents cannot pay for the services, treatment should not be discontinued, specifically when the child is salvageable. Okay, alternative avenues to fund the treatment should be sought after. For example, insurance companies, government policies, NGOs. Okay, they can help provide financial help, aid, or you can just transfer the patient to a government facility which is suitably equipped. Okay, so that you can carry on the treatment there as well. Withdrawing ventilator support if the patient cannot be salvaged. If the patient, you are very sure that the patient is absolutely brain dead, the patient cannot be retrieved back to the normal. Okay, in such situation, ventilator can be withdrawn with informing the patient's family. Okay, and in such situation, whoever is the senior most person in the hospital, they should also be involved in this decision making, giving this information to the family members. It will be very distressful for them. So make sure the senior most and the well experienced physician, whoever is present in your hospital, they are also part of this decision making. Okay, sometimes it is also good to involve administrators or medical social workers, other support groups as well, to take care of the family's emotional needs. Okay, if the family members still do not consent for withdrawing the ventilator support, it should be continued as long as they are as long as they will come to believe that it is completely futile to keep the patient on ventilator. Till then, it has to be continued. Complications of ventilation are very common: ventilator-associated pneumonia, worsening of acid-base status, okay, pneumothorax, high PEP, okay, cardiac output is too much. Okay, so these are the complications of ventilation. But what parents may think is that it is because of medical negligence that this has took place. So before taking the consent of the parents, you have to tell them about the complications of ventilations as well. Okay, you have to straight out all the complications of ventilation, so that it does not, they don't waste their time in unnecessary medical legal cases. Okay, usually when these complications take place when a child is on ventilation, parents may think that it is because of medical negligence that these complications have took place. But these specifically ventilator associated pneumonia and all, even with as much as care you can give, certain things are not in the medical fraternity's hand. Complications can take place anywhere and anyhow. Okay. In case of death on ventilator, it is very difficult to diagnose as well, okay, because respiratory support and can prolong the functioning of the heart for a pretty long time. And if the patient is brain dead, it is not diagnosed pretty soon, because on ventilator the patient is already in a comatose situation. Okay, and as long as the respiratory support is going on, because of the help of ventilator, the heart will still keep beating. Okay, so death on ventilator, it is not easily diagnosed. Okay, video of the EEG is the gold standard used to diagnose the brain death patient on ventilator. Okay, and wherever if this video of EEG is not available, other clinical parameters like fixed and dilated pupils, okay, absence of corneal reflexes, absence of motor responses, okay, absolute absence of caloric response, absence of gag reflex, okay, these all things can be checked to make sure to verify a death. Okay, otherwise if EEG is not available, only then go for these various parameters. Okay, lack of spontaneous respiration when the ventilator is removed. Okay, these can be also used to diagnose a brain death situation. Ventilator malfunctions, which is very it's not common. Okay, ventilator being malfunctioning is not a usual occurrence. Okay, however, there is always a backup available in the hospital. That's a hospital administration's job to make sure that backup ventilators are available. Otherwise, it could be a life-threatening situation that could not having a proper backup of ventilator, or ventilator malfunctioned and that caused death to the patient. Okay, this could land the hospital into medical legal issues. Okay, so there to avoid that, make sure there is always a backup ventilator when all the patients are on ventilators. Still, backup ventilations are available. There are no specific guidelines for this particular situation. It is a very subjective case. Every individual case will be dealt separately, and based on the gravity of the situation, based on the history of the complications, a decision will be taken. And if a manual ventilation is not available or a backup is not available, immediately through ampu bag, the patient has to be shifted back to another facility which has a ventilator available. So these are the legal aspects of ventilation in children. So euthanasia, that's still a debate right now. In India, euthanasia is not legal yet. Only withholding or withdrawing the life supportive treatments or life prolonging treatments are followed in India, but euthanasia is not something that is followed in India. Okay, so whatever is the modern techniques of medicine that is available in terms of resuscitation, dialysis, ventilation, nutrition, hydration. Okay, after considering all that, however, life should come to a natural end. Okay, but the existence of such techniques, such advanced techniques puts doctors and patients and their family in dilemma. Should we use all the techniques to save the patient's life, or should we give up? Okay, that is the kind of dilemma people have in euthanasia. Okay, so in some cases, people just want to simply prolong the dying process and cause unnecessary distress to the patient. Okay, in such situation, the question is, what is the best interest of the patient? And the dilemma here is the patient cannot answer this. Patient is in a comatose situation. The patient cannot answer this. So, what is the best interest of the patient, to continue the treatment or to end the treatment? We cannot get the answer from the patient. Okay, so the next to kin or the doctors are the only ones who can answer this. Okay, so it's very difficult to come to an ethical answer about euthanasia. There's a lot of questions that arises. The first question is, in medical practice, the main principle is to show respect to human life. Okay, but at what cost? Just by prolonging the patient's life is the way to show respect to human life, or with withholding and withdrawing the life prolonging treatment so that you give your patient a dignified death? Is that a respect to human life? So respect to human life is a very vague kind of concept. Okay, what do you mean by that? Should you prolong the, just because it is a human life you have to prolong it as much as possible, or should you give a dignified death to your patient? Okay, so this is where the doctors have an ethical dilemma when it comes to this principle of showing respect to the human life, which is a main principle of your Hippocrates oath. Okay, so the answer can go in two ways. Then comes to circumstances. Every case is different. Every case that has been that is been discussed for withholding and withdrawing the life prolonging treatment, every case is very subjective. Every case is just a difference. So you have to analyze the circumstances completely from a 360-degree angle. From all the areas you have to see and analyze the circumstances and then come into a conclusion. Okay, the circumstances right now, is it pointing towards a dignified death, or is it pointing towards prolonging the human life? Okay, so circumstances, even if two patients are suffering from the same situation, their circumstances of the stages of disease condition or the circumstances they have, the prognosis they have will be completely different. Okay, so based on circumstances we can make a decision of withholding or withdrawing a life support system. We cannot follow a specific SOP or guidelines for these kind of situations. Then next is the responsibilities of decision making process. Who takes the responsibility? Is it the patient? Is a doctor, healthcare team, or family members, or any other person who is very close to the patient? Who has the right to make the decision of stopping their life? And how much weight should we give? How much weightage should we give to this person's point of view? Okay, how important is this person's point of view, and who gives them the right to make decision about others life, when to end somebody's life, or when to keep someone alive? Okay, it is at the end of the day it is somebody's decision. It could be a doctor, healthcare team member, patient himself, herself, or the family members. Human factors are involved in this decision making, but who is the right person? How responsible are they? How much weightage should we give to this person's opinion? Okay, this is the controversial area. Okay, so these are the main questions when it comes to euthanasia. Okay, and it will be very emotional and very difficult for the healthcare team as well. Okay, along with the patient family, it is difficult. It's a very difficult situation for the healthcare team also to withdraw the treatment of the patient, and seeing the patient pass away, gasping for breath, and pass away in front of them. It's a very painful situation. Okay, to withdraw the treatment is more painful than to decide not to provide treatment or keep the patient alive. Okay, so that's about euthanasia.